And we would just like to take some time right now to just discuss some questions that we had. A lot of our viewers, people that call us, contact us, they know we're associated with you and they ask us a lot of questions. So we would like to just go ahead and cover some of those things. First question would be, what happened in Australia exactly? You are being called a quack, you are being called someone that's crazy out there. So what really is the truth? What happened? Why were you banned?
Dr. Barbara O'Neill, born on July 28, 1953, is an Australian advocate for alternative healthcare techniques that the scientific community has extensively condemned as harmful and unfounded. Despite reports of lacking recognized qualifications and failing nursing school, she's made claims at alternative medical organizations, health retreats, and Seventh-day Adventist churches. Following several complaints from the general public and health professionals, the New South Wales Healthcare Complaints Commission barred her from providing any health-related services in 2019. Investigations reported that O'Neill provided unsafe advice to vulnerable individuals, such as proposing bicarbonate of soda instead of chemotherapy for cancer treatment and unpasteurized goat's milk for infants. Her lack of training and failure to satisfy the standards expected of health professionals reportedly highlighted the risky nature of her advice. In this video, we'll look at reports of how Dr. Barbara O'Neill misled many people with her claims of a cancer-free life, emphasizing the dangers of unqualified health advice and the non-evidence-based medical procedures.
Drugs never heal. They never heal. And I know with my mum, when she first started to get her pains in her hands, she went to the doctor who gave her some anti-inflammatories. And then as it got worse, then he put her on prednisones and cortisone.
Barbara O'Neill reportedly portrayed herself as a naturopath, nutritionist, and health educator since at least 2004, despite her lack of any relevant qualifications or training. Her husband, Michael O'Neill, is the founder of the Informed Medical Options Party, an anti-vaccination and anti-fluoride political group. Together, they ran the Misty Mountain Health Retreat near Kempsey, where clients were reportedly charged up to 8,800 Australian dollars per stay for services claiming to aid recovery from various health conditions, including heart disease, diabetes, chronic fatigue, and cancer. O'Neill also reportedly provided paid telephone consultations and presented her claims at alternative medicine organizations, wellness retreats, and Seventh-day Adventist churches.
Yes, it was a shock to us because it really had no foundation. In fact, when the complaint first came to us from the HCCC, we laughed. We thought, surely this is a joke.
Despite reports of no evidence to support her claims, O'Neill insisted her methods were valid. When questioned by the New South Wales Healthcare Complaints Commission, or HCCC, she could not provide any supporting evidence for her treatments. Videos of her presentations have been viewed over 700,000 times, and she has continued to conduct health retreats in New Zealand and the United States, even after being banned from doing so in Australia. Additionally, she's published several books on health and nutrition. Cancer treatment claims. O'Neill reportedly claims to have the ability to cure cancer. She promoted the notion that cancer is a fungus that can be treated with baking soda, and claimed that one doctor cured 90% of his cancer patients with baking soda injections. O'Neill also advised her clients to cure cancer by following a low-carbohydrate diet for 6 weeks. Reports are that her advice led to the death of a Cook Islands man with stage 4 cancer, who had declined medical intervention in favor of O'Neill's prescribed regimen of bicarbonate soda, lemon juice, and boiled water. Her supporters argue that he'd been in remission before his death. Anti-vaccination stance. Barbara O'Neill has reportedly been a strong opponent of vaccinations, stating that all vaccines are hazardous and cause a variety of health problems. In one of her popular YouTube videos, she reportedly proposed that children may be naturally vaccinated against tetanus by adopting healthy lifestyle habits, including drinking enough water, getting enough sleep, avoiding junk food, and participating in outdoor activities. O'Neill has reportedly opposed Australia's no jab, no pay policy, which links certain parental tax breaks to up-to-date child immunizations. This program seeks to boost immunization rates while protecting public health. Her association with the Informed Medical Options Party, a party known for its alternative medicine and anti-vaccination attitude, has reportedly sparked more condemnation from medical professionals and public health officials. These experts contend that O'Neill's anti-vaccination rhetoric undercuts attempts to preserve herd immunity and protect vulnerable people from preventable diseases. Despite overwhelming censure, O'Neill continues to preach her views about vaccines, antibiotics, and infant nutrition.
They're saying that I'm advocating that a woman go and put her baby on goat's milk if she can't breastfeed, and they're claiming that goat's milk might be lethal. We just laugh because babies have been fed goat's milk for thousands of years, so this is the sort of thing. So we didn't really take it seriously.
In terms of infant nutrition, O'Neill reportedly recommended alternatives to the formula for parents unable to breastfeed, including unpasteurized goat milk and mixtures of almond milk with dates or bananas. When presented with the National Health and Medical Research Council's infant feeding guidelines, O'Neill reportedly admitted she'd never read them and would refuse to do so. O'Neill had also discouraged the use of antibiotics, claiming they cause cancer. She reportedly advised pregnant women against taking antibiotics for strep B, stating that no baby has ever died from strep B contracted during birth. Reports from the Royal Australian and New Zealand College of Obstetricians and Gynecologists showed that 14% of newborns who contract early-onset strep B die, a risk significantly reduced by antibiotics. Investigations and prohibitions. The HCCC began investigating O'Neill after receiving several complaints between October 2018 and January 2019 from health practitioners and the public. The complaints mentioned her health advice, such as recommending bicarbonate soda for cancer treatment and unpasteurized goat milk for infants.
I think a nutritionist from Queensland was one of them, and she had looked obviously through my lectures and came up with something like the goat's milk.
The investigation reportedly revealed that O'Neill lacked any health-related qualifications and had failed to maintain records of her health advice as required by law. While reports claimed she had diplomas in naturopathy, nutrition, and dietetics from now-defunct organizations, the HCCC confirmed she had no verifiable health-related qualifications. O'Neill claimed she merely provided information rather than health advice and never claimed to cure cancer. On September 24, 2019, the HCCC banned O'Neill indefinitely from providing health services or education in any capacity, whether paid or unpaid. This ban included giving lectures, public speaking, or seeing clients. Despite this prohibition, O'Neill continued to advertise her services online and through the Misty Mountain Health Retreat. Ongoing activities and legal issues. Following the HCCC's decision, O'Neill reportedly attempted to rally support by launching an online petition calling for the reversal of her ban, with claims to be the victim of a Nazi-style propaganda campaign. In late 2019, the Australian Charities and Not-for-Profits Commission began investigating Misty Mountain Health Retreat for potential breaches of charity law. The retreat had received government grants and tax concessions under its health promotion charity status to provide diet, exercise, and health advice to marginalized communities. After being barred from providing health services in Australia, O'Neill continued her activities abroad. In October 2019, Cook Islands Health Secretary Josephine Herman reportedly raised concerns about O'Neill conducting health workshops in Rarotonga, leading to an investigation by the chief medical officer. Additionally, O'Neill scheduled wellness programs in the United States and continued to offer services to cancer patients. Well, that's it for today. Let us know what you think of Barbara O'Neill by sharing your views in the comment section below. For now, make sure that you like our video, subscribe to the channel to get updated, and don't forget to hit the bell icon to never miss an update. Thanks for watching the video. See you at the next one. Stay healthy.